Gentleman from Iowa seek recognition.
Mr. Speaker, I have a motion to commit at the desk.
The House will be in order. Shh. Gentleman from Iowa.
Mr. Speaker, I have a motion to recommit the desk.
Is the gentleman opposed to the bill?
I am opposed to the current form.
Gentleman qualifies. The clerk will report the motion.
Mr. Boswell of Iowa moves to recommit the bill H.R. 3010 to the Committee on the Judiciary with instructions to report the same back to the House forthwith with the following amendments. Add at the end of the bill the following section, guaranteeing the lowest prescription drug prices for seniors. This act and the amendments made by this act shall not apply to new regulations or the revision of existing regulations that reduce cost or increase coverage for pharmaceuticals and other health services for seniors, or efforts by the Secretaries of Health and Human Services, Veterans Administration, and Defense to negotiate lower prescription drug prices.
Gentleman from Iowa is recognized for 5 minutes.
Thank you, Mr. Speaker. My motion to recommit will provide both parties with the opportunity to come together to save hundreds of millions of dollars, rein in federal spending, and support American seniors, American troops, and America's veterans. Let me be clear. Listen up.
Mr. Speaker, the House is not in order.
Could the House please come to order? Gentleman from Iowa may proceed.
Thank you, Mr. Speaker. Let me be clear. The passage of this amendment will not prevent the passage of the underlying bill. If adopted, my amendment will be incorporated into the bill. The bill will be immediately voted upon. The amendment is direct and incredibly important. Simply put, it will prevent the underlying bill from creating regulatory hurdles for low-cost drugs. Day in and day out, we talk about spending in this country, and particularly in this Congress. Well, my amendment gives the chamber the chance to rein in one of the greatest culprits in our out-of-control spending, health care. Today, health care spending is more than 17% of our nation's GDP, a number so massive that a 5-point reduction would save Americans $870 billion. Medicare Part D covers 29.5 million Medicare beneficiaries. So how do we pay for prescription drugs? 83% of Medicare Part D funds come from our nation's general revenue, and CBO has estimated that America's Medicare Part D spending will total approximately $53 billion in 2012. That's quite an incentive to pay for drugs wisely and efficiently. This amendment helps us to do that. First, it protects current and future regulations that lower the cost of pharmaceuticals from being hindered by the underlying bill. We have done too much to support American seniors and improve health care today to let regulations increase costs on our citizens or jeopardize their access to care. Nationwide, we have provided greater access to health services to Medicare beneficiaries and reduced the costs by allowing access to discounted drugs in Medicare Part D. We sent checks.
Will the gentleman suspend? Could we please have order in the House so the gentleman from Iowa may be heard? Gentleman may proceed.
Thank you, Mr. Speaker. Please listen up. This is very important to all of us. We send checks to seniors this year. We sent checks this year who hit the Part D donut hole, and we made a commitment to close it by 2020. We must continue to aid our seniors and reduce the cost of their medicine, but we must also reduce the cost to our nation. The second part of the amendment ensures that this bill will not prevent the Secretary of Defense, Veterans Affairs, or Health and Human Services from negotiating for lower drug prices. Military health care covers the needs of more than 9 million individuals, ranging from active duty, their families, and veterans. Fortunately, the Secretaries of the Department of Defense and the VA have the authority to negotiate with companies on the price for drugs. We must protect their ability to serve the millions of military members, active duty and retired, and their families who have served our nation. Not only will this amendment defend the right of these agencies to ensure the best prices for our veterans and military families, it will protect any future provision that would provide the Secretary of Health and Human Services the same power to serve the nearly 30 million Medicare Part D beneficiaries and make medicine more affordable. Our constituents know what a driving force healthcare costs are in our nation's spending crisis. They feel it every day in their homes and do all they can to get by. My own constituent in Des Moines, Jan, recently wrote to me to say that she is, quote, concerned about the prices of medicine in our country, as it's often the biggest part of most citizens' out-of-pocket health care costs, end of quote. Echoing her concern in a small town, Donna wrote, quote, countless Americans can't afford to buy medication in the U.S. and yet cannot afford to go without them. These constituents and many more told me that if we could pass legislation to lower the cost of medicine, that it, quote, it would be extremely popular with your constituents and it would be easy to garner bipartisan support, end of quote. I agree with my constituents. We should do this. I hope that you will support this, bring it back, and let's pass it, and let's be sure that we do the best we can to help our seniors, our military, the military families, and our veterans. Thank you, and I reserve the rest balance of my time.